what the HealthTech listeners, I'm your host this week, Hayley Kadia, Marketing Executive at Radar Healthcare. This is a podcast where we tackle the trending topics, ideas and best practice within health and social care. In this episode, we sit down with Erica Pryce to discuss the role of technology in modern social care. Erica shares her insights on how implementing systems like Radar Healthcare has improved safety, compliance and governance within organisations. She also delves into the challenges and opportunities of using tech in social care, from ensuring inclusivity for individuals who cannot communicate with words to overcoming resistance from tech-phobic colleagues. Join us as we explore practical tips for choosing and managing digital systems and what the future holds for tech in social care. So welcome to the podcast, Erica.
Thank you.
Probably just start introducing yourself and a bit about your background within social care.
Okay. So I'm a registered psychiatric nurse, entered the world of care at about the age of 15. I've done a myriad of different roles throughout my career, most recently becoming the Chief Clinical Operations Executive for a learning disabilities charity. I've done things in safeguarding adults. I've worked with people with homeless and mental ill health. I've done a lot of quality-based things, and I suppose the running theme through everything I do is that I have to know that I'm making a difference to people's lives, and my focus is always on that cycle of quality, continuous improvement.
So I suppose what you kind of say is like, what are some of the key contributions and aspects for choosing digital systems within modern social care?
I think when you look at the systems we've had through the years, they've always been very paper-based. We moved over to spreadsheets, but there's always been this running theme of struggling to pull everything together and see things in one place. I think the thing that Radar has done for myself in my most recent role is it gives that oversight at every level. So whether you are a registered manager needing to see incidents that are being reported or seeing that people have read a document, or you are an operations manager or you're the clinical operations executive, then you are able to delve into the level of detail that you need to. And you can always see where the risks are. You can look at data analysis. And when you create action plans as a result of perhaps an audit or an incident or a complaint or a CQC inspection, it's all in one place and you can link actions. I remember as a registered manager having an action, I think I had something like 4 or 5 action plans from various different events that had happened in the home. And there were common themes throughout them, but there was no one place to have them all together. And I think the action plan is probably one of the most crucial parts in Radar. One of the more recent things we've used it for was starting to collate. You mentioned obviously people that don't use words to communicate, and being able to collate and sort of triangulate people's experience, which is obviously a key feature in the single assessment framework. And I think there's a real risk for some providers, social care professionals and healthcare professionals to rely on the voice of the person's circle of support, their families, their loved ones, which of course is a key element, but it shouldn't be the only way that we hear the person's voice. And I think gathering person's experience from a range of data and triangulating that is really crucial.
And such a key topic, because you are right, if people can't communicate effectively with words through whether that be a health condition or anything, have you had any tips on how to do that within your recent roles?
I think it's been interesting to see how CQC inspectors come and use various different things like talking mats, and they will use an observational framework as well. And I think that's where we've started trying to put things together, is to capture the observation of people experiencing their lives. because people communicate strongly, but they may not be using words to do that. And you have to know the person, and you have to look at what that is to be able to gather that and connect it to those I statements that we look at in the single assessment framework, and to understand that person can't say I X, Y, Z, but they are saying it by the way that they're expressing themselves when they are being supported or when they are living certain parts of their lives.
Absolutely. And like you say, it's the power of observation, because anyone can make an observation, and all of those observations do add up, and create like a really, really effective and really wholesome picture of that person and that person's care.
Yeah, it gives you the tapestry of it rather than a bit one-dimensional. So yeah, it's capturing, like you say, observations from people that come in, professionals, family, staff, key workers. There's lots of different angles to capture and look at how that person is experiencing their life.
So just touching on then about just rewind a few years, and what kind of red and green flags, I suppose, would you look at within tech and digital systems? What, using your experience and your experience within the industry, what would some of your tips be of what to look for, what to not look for, and how to use them effectively?
I think there's some real risks going into the world of tech. Certainly recently working with local authorities who are starting to become very keen on technology. And I think that even they've learnt that maybe sort of 4 or 5 years ago, they were very much focused on how can it save us money? How can we reduce staff by using technology? And I think in turn that meant that staff were anxious about using technology as well, because they felt that if they supported an individual to use a piece of tech successfully, then that could be a risk that actually, or they're no longer needed, or their care hours were reduced, so there won't be that opportunity. Whereas I think that has really shifted through the last couple of years, where it's about actually this is about value added into that person's life. This is about increasing independence. I suppose personally, we've looked at tech far more from the employees, colleagues, leaders using tech to look at data and to be able to manage their services better. I remember a conversation probably a good 5 years ago now with a registered manager who really wasn't keen from going from paper notes to digital records, and also wasn't keen to go from paper audits to digital audits and that sort of thing. And I think it was probably only about a year ago now that I spoke to her and her operational manager, and they literally would not go back. They couldn't imagine a day now where someone came in and said, well, can I see all the incident analysis for the last 12 months? And you've got to go through all the paperwork, or you've got to run a report on someone's health events, and you've got to go and do that manually through paperwork. I think probably one of the keys to it is understanding the hook, understanding what it is that's going to work for that person. And also, I suppose, in terms of rollout, is making sure that you tailor your approach to different people. There will be people that are absolutely fluid and they just want to get going with it, and there'll be other people that you have to sit down beside them and support them through. I think the way we did Radar was in modules, so I think that's another. You got people comfortable with using one part of the system. It wasn't flooding them with every part of the system, and yet there were other people that wanted to see, oh, can it do this and can it do that? And, yeah, slow down. Let's just do bits at a time.
Gets exciting, doesn't it, when you actually can realise like how much time sometimes you can save, or what the system can pull out for you, and then you're like, oh, can it do this, or oh, can you do that? And you can understand why people get really excited by the system, and when they start to see the value in it, it really is an effective tool.
Yeah, and I think both with Radar and Nourish, which is our digital record system that we use, we're constantly adapting them and configuring them. Things happen, the landscape changes in regulation, whatever it might be, and most of it is within our gift to be able to go into and tweak it and change it, even down to, I think, support staff and other frontline colleagues who will say, is there any way it could do this? And we're able to make changes, and then they feel quite powerful as well.
I suppose that's the beauty of having the system as well, and it's that two-way conversation of having feedback from people that are using it, and everyone else as well. Like it's making sure that the system can adapt and fit to them, which is also another important aspect, I suppose, of having like tech, is making sure that it works for everyone and just doesn't add something more, another element to a person's job that they've got to do.
Yeah, there's certainly things that we've looked at that we've said, this doesn't make any sense for it to go onto a digital platform. This is something that is done in the vehicle, for example, and it's easier for those staff to do it on the digital records, for example, rather than logging into Radar because they're already in there. Or so it's about being sensible as well and making sure that you understand the purpose and what it is you're trying to achieve.
Absolutely. It's definitely got to be a balance, hasn't it, for everybody?
Indeed.
So I suppose, Erica, you've worked with organisations to implement technology like Radar Healthcare. What benefits have you seen from adapting to a digital governance system?
I think the main benefits have got to be that access to data, the ability to look at trends, the ability to understand what's happening in a particular service without having to physically, geographically go out to that location. I think it's helped people with a range of factors, even just down to things that would have previously perhaps been in a diary and are now in as a scheduled task. We've put our strategic risk register on there. All of our meetings go through there. I think there's been very useful things. We've had CQC inspections where they'll ask for something and we run a report and it's there. And I think you could never do that when it was on paper-based systems, or even on digital systems, but perhaps saved on the cloud sort of thing, or on the computer. So I think it's data at your fingertips is the most important thing. And I suppose also I think we've had a real good flow. I like the way that when you do a one-to-one with someone, for example, it will then go to that person to sign off to confirm it's right and come back to the line manager in case there's any further comments that need to be added. And we've got that with a range of different things, our probation processes, our induction processes. It's a connective piece. The workflow allows that. And in our incidents where they flow through to our PBS lead and to our health and safety lead or to the operations manager, and you can see that whole journey, including the learning and the outcomes and any actions that are being taken.
And I suppose that's a really important thing, isn't it? You can see the learning, you can see the outcomes, you can see the processes that have been followed, and you can kind of take from it what you need to take from it to put actions in place. So I think that's another important aspect for you, and obviously has been important within your organisations.
Yeah, our regulators and our commissioners have got a real focus on that shared learning, continuous improvement. And I think that having a digital governance system allows you to do exactly that, allows you to show how you've learned from something in one area and shared it in others. We have notifications that go out across the whole system that let people know that there's learning to have come from something that perhaps might have never reached them before, because it's completely geographically dispersed.
Yeah, like you say, it's multiple locations, isn't it? So what you can learn from one, you can then spread within the whole organisations for other locations as well. So it's learning from a whole base, which is something that would probably never be before, because unless people, managers of the homes spoke to each other, they probably wouldn't ever hear that as well. So.
I think it's timeliness as well. So there's always been sort of lessons learned groups where people have taken a lesson from an incident and gone to a forum or gone to a group and shared it, and then eventually it's made its way back. But the way we have the system set up means that an incident can happen, it's investigated, and its learning is instantly shared with everybody. And there's no barriers to making sure that you attended that meeting or you read those minutes, etc., etc. It's there, it's with you.
That's, really interesting point. I suppose one of the other things is to talk about is how technology can help with inclusivity and better communication for everyone within social care. I suppose, have you got any thoughts on that and how it's helped?
I think technology and inclusivity is hard. There are lots of different technologies that people use to communicate with, but it never quite gets rid of the need for needing to actually understand that person and how they communicate. I think one of the crucial things from our digital care planning is that has all of that information about how that person communicates, and it manages to capture that experience of that person, like we talked about earlier. And then I think the feedback collation tool that we created in Radar has enabled that triangulation that we talked about. So you're capturing all those different observations, you're capturing all the different ways that person does communicate, and what they are able to communicate with you about how they are enjoying their lives, feeling safe, etc., etc.
Yeah, absolutely. And I suppose one thing to note on that is like how far it's come. You know, we are talking like tech in the last 5 years that has really excelled within this area. And I suppose a question for you would be, where do you kind of see it going in the next 5, 10, 15 years? And what would you kind of hope that would help to achieve for these people?
I think when we were talking previously, we talked about something that I'd seen on LinkedIn around a new communication system that was connecting electrodes to the person's head and being able to convert thoughts, feelings, what was going on into words on a screen. Sounds a little bit scary. I think you and I said it was almost touching on the side of do I really want someone to know all my innermost thoughts? But I think that will be hugely powerful if we could genuinely get to a place where we were able to get people's thoughts and feelings from non-verbal communication in a more independent and neutral way, because everything we have at the moment relies on another person and their interpretation of that. If there was something that was, more objective rather than subjective, that would make masses of difference to the way we deliver services, the way we understand how people experience them, and people obviously at the core of that being able to communicate their own needs and wishes more eloquently and more ably, that people can understand them. Unless, that person's not in today that really understands me very well. It's like, well, actually I can communicate no matter who's in front of me. Be nice to see that in 5 or 10 years, maybe more towards the 10, but who knows?
Absolutely, I couldn't agree with more. I think also as well, it brings it back to that is like, it's totally the care around that individual person, and everything about that person will be accommodated for. I think when you struggle to communicate and talking as a primary communication method, it can be challenging for other people to understand as well, and it can be frustrating for the person as well, just to get their point across. And I suppose it'll give them more encouragement to say what they want to say.
Absolutely. It would certainly, people that have had strokes or brain injuries or something along those lines where previously they would have used verbal communication as well, to give that back to them would be huge. Yeah,
absolutely. Hopefully that's not too far away. Surely with tech as it's going, there's got to be a solution. We're just suggesting it first, aren't we? We're saying yes. Okay, so for organisations that may feel slightly tech phobic, I think we touched on it previously, briefly, but have you got any tips or things that you've kind of achieved in your recent roles that you've kind of overcome that barrier for addressing those that maybe are a little bit reluctant to adopt new technology?
I think you've got to help people understand what it can do for them. I think that's probably the crucial factor. In terms of digital healthcare records, I think frontline staff, once they realised that actually they could potentially press a button and speak into it, and it would just type for them, that's potentially for some people sort of was a big win. I think from a leadership point of view, the governance systems come into their own during local authority inspections, reviews, CQC inspections, obviously, anything where they're needing to demonstrate outcomes or data or the whole governance piece around incidents and complaints and so on and so forth. I think usually once you've taken someone through the process of one incident or one complaint or one thing and then go on to something else, and you can start to see how things join up and connect, they start to see the value in them. As I said before, I think doing it gradually is really crucial. I spoke to another organisation recently who said that they were on their implementation journey, but had paused while they were sort of assessing how the bits that they'd done so far were being, rolled out, were being embedded. And I think that's probably quite crucial, checking in, making sure that people understand what they're doing, but why they're doing it. I think the why is really crucial. I think that's the same with anything in our industry. If you don't help someone to understand why we're asking them to do it, then they won't necessarily carry on doing it or do it very well. And I think always linking it back to the outcomes for the person and how that actually does input to good care and support, because people can think, oh, I came into care to care for people. I don't want to do all this tech stuff. But you actually have to turn it around and help them to understand what it's achieving for this person's safe care, effective care, reviewed care, continuously improved care. And when you start to demonstrate some of that, people start to sort of see it, and it connects, and they connect with the delivery of the care for the person.
Yeah, perfect. I think following on from that as well, I think maybe there's a shift in what a career in care kind of looks like that probably needs to be addressed within the whole of the social care community and healthcare community. Being access to all of these tech solutions and stuff like that. You do come into care, but it's such a rewarding career, and there's so much scope for to access heaps of different apps and modules and systems and stuff like that. It's a challenging career in multiple aspects.
Yeah, I think it is a tools skill set that you need now. I think when you come into this industry, you need to be able to do those digital things as well. But we tend to talk about it at interview. We tend to ask people, can you do Facebook? Can you do, I don't even do the other things, but like, other social media platforms, and people will say, yeah, I know how to do that. So, well, if you know how to do that, that'll be fine. You'll be able to navigate your way, and they are able to do that 9 times out of 10. People are well able to get on board with the systems, and again, eventually get used to the sort of how to use it, and how to use it with the people they support as well.
Yeah, I suppose that's building a system as well that's super easy to use for everyone, thinking about processes, workflows, action plans, and what you're asking people to fill in and how it all works and everything like that. It's taking steps into consideration for everyone to use. Yeah,
you've got to make it as user friendly as you possibly can.
Coming close to the end, I suppose, what's your kind of view on technology and social care? What do you kind of envisage going on in the next, 20, 30 years? What do you kind of see changing?
I think we've got to find the balance. Social care is always going to be about people connecting with people, but I think we have to work smarter. The requirement for social care, we know, is going up year on year, and the numbers of people to deliver it are not going up at the same speed. So I think we do have to think about that smartness of technology, how to achieve things with it embedded, not being fearful of it. I think we need to go on that journey gently, and help people along the way to understand what it can achieve. There's also a lot of work to be done with the people we support as well, because actually there's a lot of individuals that don't want technology in their lives in the same way that perhaps others do. And some of that is about how, again, in the same way really, that you support individuals to understand what there is available and what it could do for them or their loved one, and trying things out. I hope that there will be more opportunities to try things for people in the future, and understanding perhaps what is it you're trying to achieve, what is the problem, or what is the need, and what options are there. And so there should be things that people can try without fearing that, oh, that means my support worker is going to be taken away on a Tuesday morning, sort of thing. So I think commissioners are going to need to get a lot better at being more flexible with how they commission support, and hopefully there will be almost libraries of tech for people to try for various different outcomes.
That's really interesting, a really interesting thought process of how it can happen in the next well, probably more mid to long term, isn't it? And how we see tech and social care. I can't imagine that's going to happen next year or anything like that. So,
no, and I think the other... Oh, sorry.
No, go ahead.
I think the other logical thing that really needs to happen is the joining up of systems. And I don't quite know how that would work, but integration between health and social care, the digital records that we have, it just seems like a no-brainer to me. And I don't know why we haven't got further along that journey than we already have at the moment.
Absolutely, it's joining up all the systems, isn't it? So there's just one continuous path for every person that goes through health, social care, anything really. Everyone has access to the same records. Everyone knows, and I suppose that kind of brings it back to, as well as you go through different health and social care pathways. If you do have like you struggle with words, or you don't use words as a primary communication method, it's all written there, it's all there, so your care is going to be much more better. Everyone's going to know how you like to communicate, and it's giving that choice and that freedom back to the individual, and that care centered back around that person.
Yeah, the seamlessness, that's what we need.
Yeah, absolutely. So at the end of every podcast, Erica, we do ask what the HealthTech moment is, and we've kind of seen everything from the funny, the serious, absolutely everything has been a great insight into tech and what healthcare as it is. So Erica, what is your what the HealthTech moment?
Not particularly a tech moment, but something that I think is crucial. And we've sort of touched on it a little bit today around sort of why we do the things we do. Now, I'm someone, like I said, was a nurse originally, and I've gone into leadership. But the thing that lasts within me is making a difference to the people that we support. And I remember as a very young, newly qualified nurse going out to assess a man who was very similar in age to me by about a year. And it was really difficult because on paper, there was nothing particularly crystal to be able to say, actually, this person was at risk. But my human instinct knew that there was something, and he was at risk. And I returned back to the team, speak to the consultant, and I said, look, I've done my assessment, I've written it up. It's not particularly clear as to what's going on for him, but I believe that his life is at risk. I believe he is really struggling. He is unsafe. They went out the next day because she took me on my word, which was great. Assessed a young man, came back with a colleague of mine, and they said, no, we don't agree. We're discharging him. And a couple of days later, we were contacted because the young man had taken his own life, and found in the garage by his family. And we were having a sort of a debrief meeting, and I I got quite upset, quite tearful and emotional. And I remember the colleague that had been out to see him with the consultant, and she said, "Oh, don't worry, cheer up," or something along those lines. A few years down the line, and you won't get so upset by these sorts of things. It's all part of the business. When you've been in the industry this long, you won't worry about it. And I was shocked by her comments, and I said to her, the day I don't get upset when a man in his 20s takes his own life is probably the day that I should leave the industry. And I've been reflecting on it recently, having just come to the end of my role, and thinking about what does the future look like for me. And I've done lots of different things in my career, but it always has to be something that I'm emotionally connected to, and I'm never going to apologize for being emotionally affected when an individual that I've come into contact with has been harmed or has taken their life or something like that.
Yeah, thank you so much for sharing that. It's clear to see it's had like a lasting impact on you, and I would agree. Like it would be hard not to get emotional when a young man takes his own life, especially within the circumstances, and on the effect then on the family as well. Finding him, I can imagine it is hard, very, very hard. So yeah, I completely agree. I think that's where you come into care as well, isn't it? It's to care for everyone, to make a difference, and from everyone else, it's really amazing that so many people do take that responsibility on.
Yeah, well, my nursing course was called Making a Difference, which is MAD for short, which is quite funny actually. But it genuinely epitomizes what I intend to do and have always intended to do.
No, that's great. All credit to you as well, Erica. It's a really, and you can see how you've made a difference in so many lives, and that's definitely got to be a huge accomplishment for you, and everything that you've done. So well done from everyone.
Thank you.
So thanks for joining us this week, Erica, and thanks to you all for listening at home. Join us next time for another episode. Don't forget to rate and subscribe, and if you have any questions for myself, Erica, or any topics we've discussed today, don't forget to get in contact at whatthehealthtech@radarhealthcare.com. See you next time.